Now, there are growing fears of the virus outbreak spreading more widely in the United Kingdom. And this comes after it emerged that the most recent case in the country had attended a conference in central London. Britain's 9th case is now being treated at a specialist unit in a London hospital. And it's thought she contracted the virus in China, and contact tracing is underway. Meanwhile, dozens of Britons evacuated from Wuhan have been released after 2 weeks in quarantine. No one tested positive. Ollie Barrett is in London with the latest. Ollie, tell us, what's the mood now in London like, especially with these details about the latest case coming to light?
There is a certain level of anxiety here in London, yes, not least because it's a densely populated city. We've heard warnings from health chiefs that environments like the London Underground, for example, the tube network, are really the type of environment in which a virus like this can spread, and can spread rapidly, in the same way that seasonal flu often does here in the British capital. You mentioned that concern around the fact that one of the coronavirus cases was at a conference in London with around 250 other people. All of those people are being contacted to be given advice on what they should do if they feel like they might be experiencing symptoms. Also concerns about the fact that the latest case appears to have taken herself to hospital in an Uber. That is certainly not the way that health officials here are advising people to act if and when they do start to believe they might be experiencing coronavirus symptoms. We've also been hearing some anecdotal evidence from people who have an Asian background or perhaps are of Asian appearance, saying that, for example, on public transport, they're experiencing sometimes people looking at them and moving away from them. We're seeing parts of town here in London like Chinatown quieter than normal. Again, health officials say that is unnecessary. That is not the way that people need to behave. But there is in the British capital, as I say, a certain level of anxiety now.
Certainly, this virus isn't discriminating against any ethnicity, Ollie. Detection is going to be key, though. So are UK authorities looking into more possible cases of this COVID-19 virus?
Absolutely they are. There is a lot of testing going on now. We know from the latest statistics that over the last month here in the UK, 2,512 Britons have been tested. Now, of course, only 9 cases so far, so that gives you a sense of the fact that most people who believe they might have this virus do not at this point. But we've also heard that in the last week we've had a peak in the amount of people testing for the virus in one day, that number coming in at 763. None of those people tested positive, but there is, as you say, a huge amount of testing going on now on a daily basis.
So amid these fears, is the UK government ramping up measures to prevent further spread of the COVID-19 virus?
Well, a lot of it is about education. It's about talking to people in London, but also elsewhere in the UK, and trying to get that advice across about what people should do if they believe they might be demonstrating symptoms. The advice at this point is to self-isolate effectively, stay at home, do not rush to the doctor or straight to a hospital, stay at home, call health officials and they will advise you what to do next. And it's very likely, if they believe that you might be demonstrating realistic symptoms, that somebody will be sent to you to take you to the appropriate location, which is very likely to be a hospital perhaps in London, where the cases that we've seen so far have, for the large part, come to be treated. The UK government has also brought into force that power to effectively detain people in quarantine if thought necessary. That is so that if a potential patient wants to abscond or wants to leave quarantine, the British government now has the power to keep them there.
All right, thanks for that update. Ollie Barrett speaking to us from London.